So I'm a physiotherapist just working for the local company, Castlereagh Coast Physiotherapy. And I've got Jody Spicer, the local girl right next to me as well, who's one of the exercise physiologists. So BCNA have asked us here today just to talk to you about what we have to offer you guys here locally. And that's within Mission Beach, Innisfail and Tully. But we also serve much wider than that as well. We go as far as Cardwell, even sometimes into the Tablelands as well. So unfortunately, there's just not a great deal of physios around the place. So it's great that we actually have this service here. So who are we? So this is actually an old enough photo because you can tell by my skin colour. It was when I first moved to Australia. So there's a couple of new faces on there as well, but we're expanding all the time. I don't think Rob knew that it was going to actually be such a big bombshell coming here, but yeah, it's great that we're always expanding. So this is one of our clinics, so that's in Tully. So it's building on over 30 years experience under the great leadership of Rob Harris. And Rob is just a fantastic physio. He's worked all over the world with Red Bull, with loads of different teams. So it's so great that we have him here and we're incredibly lucky to have him. But we're a group of 6 physiotherapists. We've got 2 reformer Pilates instructors. And then, of course, we got the gorgeous Jody right next to me as an exercise physiologist as well. But we also have an incredible admin team as well who are fantastic. They're really, really great. And again, like we're saying, it's always expanding. So I'm sure next year we'll have a couple more physios as well, which would be great for the area. Every physio and I suppose every exercise physiologist, even though we just have the one right now, we're all very different and we have our own different niches and our own different special interests. So it's not like we're the same old musculoskeletal physiotherapy clinic. We do much more than that, and that branches out into neurology, respiratory. We do a lot of NDIS care as well, and of course cancer care too. So every physio is different, which is it's quite nice to have a couple of different characters around the place as well. We've got 3 beautiful clinics. So like I was saying, there's one here in Mission Beach. It's one of our smaller ones. We've got one in Tully with the gym in Tully as well. And then we also have one that we just opened up in Innisfail only about, I think it was about 6 or 7 months ago. And then Jody has opened up a very popular reformer Pilates studio just around the corner here as well. So all the local people here are absolutely loving having that as service now as well, which is great. So I'll just talk a little bit about myself. So I qualified in physiotherapy in England in 2016. And then following that, I just wanted to get as much experience as possible. So I completed my junior rotations in a major trauma centre just along the East Coast in Hull. Before trying to specialise as a physiotherapist in musculoskeletal care, which I did for about 2 years there as well. And during that time, that's where I mainly came across my cancer care there, which was absolutely fantastic. And that's where I'm bringing my experience to here today. It's just from that time in the hospital there. After that, I just needed a little bit of a change of scenery and just spice things up a little bit. So I decided to go over to the Ministry of Defence and worked on a large Navy base down the southwest coast of England as well. And then I got really, really sick of really terrible weather in England and decided I needed a little bit of sunshine in my life. And I found a job advert, which I actually thought was a scam at first because the heading was work in paradise. So I thought, okay, it could be dodgy, but I'll send my CV along. And then 3 months later, I came over here because I found out that it was actually Rob Harris, who's known all around the world, like I was saying. So I thought I'd definitely further my career here. And I've been here ever since then. So that was about 2 years ago. My main interests are post-operative care. So that's quite applicable to cancer care as well, but also in women's health as well, which I'm trying to bring a little bit more of that area service here into the area as well. So now I'll pass you on to Jody, who can speak about herself now.
Thanks, Maebh. Oh, everyone can hear me. Hello, everyone. I'm not going to take up too much of your time. I know it's been a very long day and you're probably all eager to get back to where you've got to go to. As you know, my name's Jody. I am the exercise physiologist that is from the area. I'm a local girl. I grew up here, born and bred. I then moved to Brisbane to do my university degree, where I stayed for a couple of years living the city life. I never thought I would come back home. I was the one child that mum and dad always said, Jody will never come back to Mission Beach. She's got her sights set on bigger things. And lo and behold, I'm here and I love being back. I think a big thing that I started to realize was the lack of services and opportunities that living what people from the city would call rural and remote, we don't have access to here. Obviously, we living here don't see it as rural or remote. We have Woolworths, we have lots of different services, but we are lacking a lot compared to what is available in the bigger, more metropolitan area. So when I came back, it was my desire to do as much as I could to help people living in these rural and remote communities, which is why I started up my Reformer Pilates studio, which is over at the Big Cassowary, and started Exercise Physiology with Rob. So enough about me, I'm boring. It's all about you guys, and you want to know what exercise is and how you can improve your exercise capacity with or following your diagnosis, during your cancer treatment. First things first, I'm going to skip a slide ahead and then backtrack. There we go. What is exercise? Anyone? Great. Movement. What else? Increasing heart rate. Yep. Flexibility. Great. Don't cheat off the slides, guys. Don't read that. Don't read that. So the big thing to think about is exercise is not one specific modality. There's lots of different types of exercise. And what one person likes, the next person won't. And that's fine. We've got to find what works for us, particularly as well when we've got a diagnosis that we've got to work with. So these are general guidelines, absolutely general. So they're an umbrella term that we can just live to day by. So aerobic exercise relates to our heart. So it's our cardiovascular system. Examples of this type of exercise: walking, swimming, running, cycling, those things that, like we said, start to increase that heart rate slightly. As you can see on the slides, we should be aiming to do that type of exercise 3 to 5 times a week. So it doesn't have to be every single day. The intensity there, we will work on what's called an RPE scale. So that's your rate of perceived exertion. So we use a scale of 1 to 10, 1 being you're sitting down right now, 10 being you are gasping for air, you are running away from a lion, working at your hardest capacity. So your aerobic exercise should be somewhere between a 4 and a 6. So when I'm working with clients, I like to say, when you're doing this exercise, say walking, you can hold a conversation. You shouldn't be able to sing a song. Yeah, so you are working that a little bit harder. Ideally, we're working for a time of 30 minutes, but this can be broken down into smaller segments. So you don't have to go out and say, all right, I have to put my running shoes on now and walk around for 30 minutes in one big stint. We live in Far North Queensland and it's hot. So trying to find a time of the day where you're not sweating or out in the sunshine is hard. Break it into smaller segments. So 10 minutes in the morning, 10 minutes around the middle of the day if you're walking around Woolworths, 10 minutes in the afternoon. That will break down your 30 minutes. So it can be broken up. That's your aerobic exercise. Resistance training is things that help to build muscle. So we're talking the common go-to, going to the gym. But who likes actually going to the gym? I don't. I definitely don't. But I like doing things from home where I don't have to worry about machines. I don't have to worry about weights. I can actually use my own body weight. So Maebh is going to give us a great example right now of a resistance exercise that you can do any place, any time. It's a squat or a sit to stand. So she's sitting down and she's standing up. If you're someone who has a little bit of concern about your balance, put a chair underneath you. So let's go do it quickly. Maebh's going to get a chair. No. We're going to come here. Everyone's got a chair at home. Can everyone see Maebh? She's going to pop her hands across her chest. She's going to sit down. And then she's going to stand back up. Well done. Thanks, Maebh. Everyone give Maebh a clap. Well done. So I know that seems really like a simplistic exercise, and it is, but it's building strength in your legs. It's building there's an element of balance to it. So we're working on our falls prevention, which we know is important as we age. And it can be done any place, any time. So doing 10 of those, having a little rest, another 10, have a little rest, and do it a third time through just for good luck, is going to start to build that strength in your legs. And you don't have to go to a gym to do it, which is a big bonus. Flexibility is our stretching. So making sure that whilst we've got strong muscles, we've also got nice long and limber muscles. So it's being able to reach above our head and put the clothes on the clothesline. It's being able to bend over and touch our toes so we can pick something up from the floor. When we're looking at our frequency of this, it's 2 to 3 days, 2 to 3 times a week, as is our resistance training or our strength training. And take a photo of this if you'd like, so you can look back on it for later. The big thing about this slide is these are guidelines. They're a basic recommendation. So it's not an individualized recommendation for Sharon. It's not an individualized recommendation for Jessica. Yeah. So with a diagnosis, we know that everyone's going through something slightly different. And your exercise has to be tailored to suit you specifically. So when you're coming to see us as a health professional, early intervention is better. So studies have shown that exercise can help pre and post treatment. So pre-treatment, we're getting you prepared to tackle the journey that you've got ahead of you. So if you're having a surgery, it's making sure, like you would before you're going in for a knee operation, that your body is nice and strong, fighting fit, ready to take you through that next part of your journey. Once you've gone through some part of your treatment, it's then the rehabilitation phase afterwards. It's saying, all right, we've had a period of lull. Let's start to slowly build you back up. So when you're coming to see us, the more information you can give us, the better. That way then we can time your exercise with your treatment. So if you're having chemotherapy treatment for 12 rounds, you've done 1 round already, we want to know where you're at with that, the side effects that you're having, because we'll tailor your exercise to that. There's no point us pushing you super hard and making you more fatigued when your body's already in that state. We just want exercise to make you feel better, because we do know it has not only physical benefits for your body, but the benefits for your mental health are paramount. We also like to work with your treatment team. So it's really that collaborative approach. So making sure that we're in communication with everyone about how you're feeling, the medications that you're taking, the side effects that you're experiencing. I'm going to now pass you on to Maebh, who's going to take on a bit of more of a post-operative approach.
2 slides, thank you. Okay, so this is just quite a small element of physiotherapy care, but I think it's something that's quite important to mention as well. And that's scar management. And mainly just want to let you know that it is okay to get right into it. And sometimes you just need that initial appointment just to know where you actually can go with it. There's no evidence to suggest that either vitamin E oil or a silicone-based gel is more appropriate than the other. I've just started using this Maebh. I just had a shoulder operation only about 6 weeks ago, and I started using that, and it seems to be pretty good. But I've just popped up a couple of examples there. It should be started when the wounds are closed, but again, it has to be on an individual basis as well, because I know that drains may be involved in that too. So it's probably worthwhile just making sure when you have that last appointment with your, let's say your oncologist or even your breast cancer nurse, just to make them aware that you do want to go to see a physiotherapist for scar management, and you're just going to ask about that. But on that initial appointment, we know whether it's going to be okay to start doing a bit of scar management as well. So that's completely fine if you don't get a chance to do that. We'll show you methods and how to best break up the adhesions, so just that grouping of scar tissue. And this will actually surprise you how much of pain relief you'll get from that as well, because sometimes it may feel like it is really truly just shoulder pain that you might suffer from, which I'll talk about in a second, but it actually could just be from the scar site itself. So it's just quite an important element of your management post-operatively. Okay, so I apologize for this one. This was a UK-based trial, so it's not an Australian trial, but I thought it was quite important to mention today. I don't know if many of you heard, but after an operation, so that could be a mastectomy or a lumpectomy, you can develop quite bad shoulder pain following it. And something that they brought up in this Prosper trial was that up to a third of women experience a restricted shoulder range of movement, lymphedema, or chronic pain after surgery or radiotherapy to the axilla. Which is a massive number, really. So that, again, should definitely be managed as soon as possible. The aim of the UK Prevention of Shoulder Problems trial was to investigate the effects of an exercise program compared to the usual practice. And the usual practice is a handout in hospital, which shows you some exercises. But like Jody was saying, it does need to be on an individual basis. Some people, they might have had some issues with the shoulder prior to that as well, might completely get rid of the exercises after the first week because they might struggle with it too. And then it also depends on what type of surgery you have as well. There's not one kind of exercise that fits everybody really with this one. So the intervention group received the best practice. So they received the leaflet that they'd normally get in hospital, but then they also received supervised physiotherapy following this as well. And it was mainly within the first 3 to 10 days they had an appointment, and then following that there was a week later, after that it was a month later, and then 10 weeks after that then as well. So it's not like you'd be seeing a physiotherapist every single week for these exercises. We'll definitely put the onus back on you guys to make sure that you are doing these exercises yourself, but then we can progress them each time that we see you as well, which that's the important part. For the likes of myself and Jody, I'll be looking at that post-operatively, and then also wanting to refer you over to Jody to then begin the strength and conditioning side of things. So it will be quite important to get through those initial exercises first before doing that. So the aim was to restore a range of movement in the shoulder, improve the strength, and increase your physical activity. And the findings were that the pain intensity was significantly lower after 12 months in the intervention group, and that it was a relatively cost-effective method of treatment. So I thought I'd mention that today. The next 2 slides are just examples of exercises that the Prosper had popped up. And it's mainly looking at posture, looking at your shoulder range of movement, not forgetting about your upper back as well, because a lot of people also suffer from quite bad back pain following surgery or radiotherapy as well. So these are just some examples as well that you could take home today. And this is just another one there as well. So there's some lower back exercises involved in that as well. So they're just 2 very, very small elements of physiotherapy management, but something I thought I'd quickly run through today. And that is absolutely everything. So does anybody have any questions at all? No questions? So I'm going I'm going once a week at the moment because I'm actually working at the Rowena nursing home on a Wednesday. But following that, I'll be there usually once a week at the clinic in Innisfail, yeah. And that could increase next year as well. Any other questions?
Hang on. My plan is I get sidetracked, and yeah, I'm definitely planning on getting up there. It's just a matter of when. But yes.
We do actually have another physiotherapist located there 3 days a week, Sunny.
Yeah.
Sunny's a fantastic Austrian girl who works there 3 days a week as well.